One of the major issues affecting women in Marsabit County is inadequate access to quality maternal care. On this episode of Health Digest, we tell you what one of the residents is doing to help change the county's maternal health indicators through the use of technology. As one travels across Marsabit County, you cannot fail to notice its sparse population and vastness of the semi-arid lands dotted with pockets of temporary homesteads compounded by cultural beliefs and unpredictable weather patterns. This vast county provides a distinct health challenge for its expectant mothers and their unborn babies. But one woman is seeking to turn the tide on this worrying health challenge through the use of technology. They say digital technologies can offer an opportunity to improve maternal health outcomes. Here in Moyale Sub-County, a 40-year-old woman is bridging the gap of access to quality maternal healthcare services by linking pastoralists to healthcare workers through a GPS platform. What started as a dream in 2017 now holds a promising future for the county's maternal health indicators. Dahabu Galgalo, a medical laboratory scientist, says she had to swing into action to help curb preventable deaths that arose among women from her community due to lack of access to antenatal care.
In 2015, there was a research that we did in this hospital just to establish what are mostly causes of maternal mortality. So through some data analysis, we came to establish that most of these expectant mothers, these mothers who are dying, they are from the pastoralist community. So these are the people who are keep moving with their animals to search for pasture and water. And sometimes this population, they usually travel even at the extent to go to Ethiopia or even the side of Somalia. And most of them, they usually access the health service. They travel more than 150 kilometers to get this clinic. So they don't access the healthcare service.
Through their findings, Dahabo and her team came up with a gadget that facilitates enhanced location of these women who ordinarily would miss out on life-saving antenatal care due to proximity to health facilities. A global positioning system, GPS technology, she tells me, was the ideal solution to help track these expectant women who ordinarily would move from one place to another in search of water and pasture, especially during this ongoing drought.
80% of the population within Marsabit County are pastoralists. And within this community also, you can't get a sort of electricity network within this community. So by using of the mobile phone, yeah. By using the mobile phone, you can't reach them. So that was the reason that we decided to come up with the GPS. So what about if we can able to give them the GPS tracking system so that we can monitor where they are? And the mobile system, that is the GPS, we came up with a sort of an innovation that it can be acceptable. That is 100% acceptable within this population. So the GPS that we came up with, it was supposed to be small, coin size, waterproof, and also solar power. The total number of beneficiaries that were able to benefit from this project were 237 expectant mothers. So from these 237 expectant mothers, when we first took the baselines data to establish whether they have ever gone to clinic or whether they have ever ever gone to antenatal clinic to get that service, almost 78% they have never attended this clinic in their previous pregnancy.
Through the use of the GPS tracker, Dahabo and her team ensured these mothers got access to antenatal care. It connected them with health workers who brought some of these services closer to them, while at the same time monitored their progress with the aim of having them deliver under the care of a skilled worker.
With this tracking system, we can able to establish the position where these mothers are. So it can make easy for healthcare workers at least to know the exact position of this population so that they can able to give them the antenatal service. With this one, at least we were able to increase the uptake up to 80%. From that 0 up to 80%. So we noted increase in the uptake of antenatal care. We noted the increase in also postnatal care and also partly immunization within that population for 2 years.
The GPS device, she explains, is fitted onto a culturally designed beaded wrist bracelet for acceptance by the community. It relays signals to satellites, which sends the signal back to Galgalo and her team via a web-based application. Hawu Mohammed, a mother of 4 from Kelelewa area in Marsabit County, was among the first volunteers in Dahabo's project. It took a lot of convincing and sensitization to have her participate in the project. She used it for a period of 2 years as Dahabo and her team endeavored to have these mothers also avail their babies for the vital childhood vaccines.
Tumekaa sana wakati watoto walikuwa miaka 2 years, tunakuja tunachukua hao watu wanachukua wakaendanga na watu wengine wanaogopa sana. Watu usiku hata ukilala watu wanaona nyinyi usivae, lakini tunachukua tu.
Marsabit County is ranked among those with a high birth rate compared to the national rate. Around 2017, its birth rate was at 5, higher than the national rate that was at 3.9. At the time, its maternal mortality rate was at 1,127 deaths per 100,000 live births, according to the 2014 Demographic Health Survey report. Despite the high numbers, most women still delivered at home, increasing their risk to childbirth-related complications, according to the Moyale Sub-County Referral Hospital Superintendent, Dr. Ibrahim Kontoma.
The uptake was low. There are cultural issues around here. People tend to lean towards traditional birth attendants, where they are being attended by old ladies. They don't mainly prefer male skilled birth attendants. So that's why they usually prefer to deliver at home.
The tracking device, he says, has played a significant role in improving the sub-county's maternal health indicators as more women now deliver in health facilities.
It was meant to increase the access and utilization of resources, the utilization of healthcare. So it has an impact in improving accessibility. And then it also has an impact in reducing the 4 delays. The 4 delays in health that can cause maternal mortality or maternal morbidity and mortality. So it has a lot of impact. It creates, it improves, the access. We are talking about universal healthcare. So universal healthcare is about access. So this particular project improves accessibility by reaching down to people who are on the ground. We are at around 60% with Save and Track. I think there is an improvement among the populations which was done. It was at 78%. So there is an improvement in ANC uptake to increase the number of visits. And then, the number of visits has also an impact on the health outcomes, because there will be an early detection of pregnancy-induced hypertension, infections. So it increases outcome. So from 60 to 78%, that is it is a project which has an impact on our outcome. Yes, maternal outcome.
The facility conducts at least 200 deliveries per day and over 30 cesarean section deliveries, making it a relatively busy facility that not only serves residents of the sub-county, but those from the neighboring Wajir County and even Ethiopia. The GPS tracker also increased immunization coverage of children, apart from boosting skilled deliveries and early screening for pregnancy-related complications.
We didn't pick the GPS from them. At least they were able to keep it, and we are able to follow these expectant mothers, these mothers also, for the uptake of the immunization for their kids. So at least for 2 years, we are able to use within this population.
With intervention of we have intervention at community level, community health workers. At least we could be able to reduce maternal mortality. But what is still very high is the neonatal and perinatal mortality rate. So we have the perinatal mortality rate is very high still. So one of the contributing factors is home delivery. And people who come to hospital late when you cannot be able to intervene. Yes.
Tracking the mothers has not also been a walk in the park for the laboratory scientists, given its proximity to the neighboring Ethiopia. The women sometimes cross over in search of pasture and water, making it hard for the harbour to take the services to where they are located.
Sometimes they usually wear the GPS, they cross towards the border side, that is the Ethiopia. So because we are from Kenya, we cannot able to cross the other side to give them the service. So the other thing also that right now we are working on is to come up with the small GPS so that it can be comfortable to be used. So the other thing is about for healthcare workers, they can able to see the position of these expectant mothers, so in order for them to give them the service.
Galgalo and her team are now looking to improve the GPS tracker to include an SOS button that will enable swift response to the expectant mother's needs in the event of an emergency. Among other features, they intend to improve in the tracker to make it more efficient.
So the GPS, the imaginary that we have, the GPS that we want to use within the community, it's supposed to be sort of a small, sort of a coin size. It needs to be solid powered and also waterproof. So that at least it can be flexible for this expectant mother to use. But the GPS which was available in the market that we are able to get, it wasn't of that the quality that we want. So the GPS that we are able to get from the market was this one, which was somewhat big and also uncomfortable for this expectant mother. And because this is a pastoralist community, and most of the time they don't usually accept something which is out of their culture, so we were able to come up with bracelets, which is the beads. So with these beads, at least even for a pilot project, it was 100% acceptable because of the way the bracelet was done. So what we have been doing is that we put the GPS inside the pocket for these bracelets, and then from there we can able to give these expectant mothers to wear it. So we were able, even though it's uncomfortable, something big, we are able to use it for 2 years. So because these women knows the importance why this needs to be done, the way we did the sensitization, at least they accepted it and they used it for 2 years. So we were able to follow this expectant mother from the first trimester until they deliver.
Even as Dahabo seeks to prevent most of these maternal deaths in her community, Kenya generally has made strides in promoting maternal care. At least 7 out of every 10 women had 4 ANC visits for their most recent live births or stillbirth, according to the 2022 Kenya Demographic Health Survey report. In Marsabit, 7 out of every 10 expectant women have had at least 4 ANC visits, as 9 out of 10 received antenatal care from a skilled provider, according to the report. Similarly, 6 out of every 10 delivered in a health facility. Overall, similar interventions like Dahabo's will go a long way in ensuring timely management of expectant women, as this can make the difference between life and death for the women as well as their newborn. Gloria Milemu, KTN News.